We're going to now move on to the second section, which is talking about climate change and skin health. And our first speaker is here, Dr. Eva Parker. She is an MD and DTMH at Vanderbilt, where she works she's core faculty in the Center for Biomedical Ethics and Society. Her expertise includes studying the effects of climate change on multiple different things: global health, HIV, dermatoses, neglected tropical diseases, infectious diseases otherwise. And she has been really actively publishing and speaking in this area and really has been a huge leader in this realm. And so we're so delighted to have her here with us today to speak, and welcome.
Thank you so much, Carrie, for that kind introduction. I'm so excited to be here. And I'm going to talk about the impact of climate change on neglected tropical diseases of the skin. These are my disclosures. So as we all know, NTDs are diseases of poverty, and they impose a devastating human, social, and economic burden on more than 1 billion people globally, predominantly in low and middle income countries. The majority of NTDs in general have cutaneous manifestations, with the WHO classifying approximately 10 diseases specifically as skin NTDs. The spread of these infections is facilitated by things like unsafe wash, lack of footwear, food insecurity, poorly constructed housing, and limited and fragile health systems. Considerable disfigurement results from skin NTDs. Consequently, psychosocial impacts, physical disability, and comorbid mental health disease are critical long-term sequelae. And these contribute to high rates of things like unemployment, stigmatization, exclusion, and distress, which further exacerbate the poverty cycle. Due to the high disease burden associated with these diseases and the morbidity and inherent inequity, skin NTDs carry important social, economic, and human rights implications. And so to frame this conversation around climate change, we have to acknowledge that the dramatic increase in the combustion of fossil fuels globally since the 1950s is the largest threat to planetary health and human health. As a consequence, the concentration of heat-trapping gases has dramatically increased, and as CO2 levels have increased, so has the temperature, such that we're about 1.15 degrees Celsius warmer than the 1880s, and we've experienced the hottest years ever on record in the last decade, with 2023 being the hottest year to date. And as a consequence, heat has become foundational to the wide range of climate impacts now being observed. The result is the growing threat of extreme weather events globally. And while specific climate impacts vary differentially based on geography, the UN asserts, quote, that no inhabited region on Earth will escape the dire impacts. So regardless of location, every nation is affected. However, low and middle income nations and vulnerable and marginalized populations are disproportionately impacted from these climate events. Extreme weather events really now define our lives, with more than 185 million people affected by disasters last year. The complex interaction of climate impacts across multiple scales, disciplines, systems, and societal levels, and result in wide-ranging consequences, which include a global health crisis with overburdening of health systems, especially in this post-COVID era, and deepening of existing disparities, massive economic repercussions, national security considerations, failure of infrastructure, food and water insecurity, poverty, mass migration, conflict, and intergenerational inequities such that future generations will be disproportionately impacted. There is a funnel effect on these health impacts that result from the pressures applied by climate change, such that our overconsumption results in ecological harm, which then drives and creates the hazards that are the proximate causes that harm human health. Geopolitics and poverty can further amplify these effects. The result is that climate change is a threat multiplier for health, equity, and health systems. In thinking about this funnel effect, we know that key ecological, immunological, epidemiological, and social cofactors contribute to the incidence of NTDs. Not only does climate change impact infectious disease burden and widen existing gaps in health disparities globally, As we increase efforts toward integrated approaches for skin NTDs and dermatology, climate-related pressures will also increasingly threaten and disrupt NTD surveillance, reporting, and treatment efforts. And I want to contextualize that aspect further. Because skin is the largest organ and the primary interface with our environment, the influence of climate change on skin disease is multifactorial with complex pathophysiology. Thus, many diseases are climate sensitive, with infectious, zoonotic, ectoparasitic, and vector-borne diseases, nutritional deficiencies, physical injury, and mental health comorbidities of particular import with respect to skin NTDs. Skin also uniquely displays manifestations of systemic disease, which are duly impacted by climate change. Consequently, environmental impacts on cutaneous disease have the potential to substantially diminish health and well-being. Not surprisingly, most skin NTDs are climate sensitive and are impacted by heat, precipitation, drought, and extreme weather events, resulting in numerous effects that increase the risk of skin NTDs by multiple intersecting pathways. In particular, climate change will increase infectious and vector-borne disease transmission. We know precipitation and flooding provide breeding habitats for mosquitoes, and warming temperatures expand the geographic range of insects and enhance replication of viral and parasitic pathogens within their vectors. Many fungal pathogens display thermotolerance to heat, and higher temperatures are associated with increased bacterial infections and possible antimicrobial resistance. Additionally, nutritional status is a critical risk factor for skin NTDs. Climate change will amplify food and water insecurity and worsen malnutrition because extremes in temperature and precipitation influence the timing, quantity, and quality of crop yields. Additionally, increased atmospheric CO2 levels increase plant biomass, thus lowering the nutritional density of staple crops. Notably, agricultural impacts are also an important trigger for population migration, which may further affect NTD incidence and control. Flooding is associated with increased risk of bacterial and vector-borne infections, as I mentioned on the last slide. Also, extreme weather events perturb the soil and frequently result in trauma, increasing the risk of inoculation of soil and debris and increasing the risk of mycetoma and chromoblastomycosis. Extreme weather events also damage infrastructure, electrical grids, and means of transportation, while also disrupting surveillance programs and mass drug administration efforts. This all diminishes access to medications and health services. Also, we see damage to telecommunications infrastructure, further reducing accessibility to remote digital healthcare. Increased rates of skin NTDs are observed in climate refugees due to overcrowding, poor nutrition, and lack of wash. Lastly, skin NTDs are also reinforce barriers such as discrimination and poverty, which are then further amplified by the socioeconomic, health, and psychological pressures applied by climate change. But just like with disease, climate forces also influence health systems in complex and multifactorial ways and subject the healthcare sector to broad pressures from climate change. Extraordinary damage from infrastructure due to these billion-dollar climate disasters is steadily increasing worldwide, with critical infrastructure such as hospitals having notable fragility. And as we discussed, extreme weather events hinder care delivery, surveillance efforts, and mass drug administration programs. But these events also disrupt global supply chains and threaten financial security of institutions. Additionally, climate change is anticipated to dramatically increase disease burden and healthcare demands. Consequently, health systems will be increasingly threatened in the future, which may contribute to NTDs becoming more neglected. Exploring vulnerability and social determinants of health are other key elements of understanding climate impacts on skin NTDs. Climate vulnerability is quite complex, and it's influenced by physiology, agency, geography, sociopolitical and socioeconomic factors, and access to resources and medical care. Women, children, and the elderly bear a significant portion of the global health burden, while outdoor workers and those with NTD-related disabilities are also at increased risk. But importantly, health, environmental impacts, and social justice, such as the legacy of colonialism, intersect in a way that deeply impacts vulnerability to climate change. And we see that skin of color, indigenous populations, and those living in poverty worldwide are deeply and disproportionately affected by these impacts. Because the wealthiest 10% of the world's population is responsible for producing 50% of global greenhouse gas emissions, a massive climate gap exists between the global north and the global south, with the impacts of climate change disproportionately shouldered by low and middle income countries. The Global Climate Risk Index highlights how climate change affects the most economically disadvantaged nations and people due to increased exposure, increased vulnerability, and far fewer economic resources for resiliency and adaptation. Importantly, each of these nations listed here produces less than 1% of total global greenhouse gas emissions. Also, in these economies, there is a disproportionate dependence on sectors that are more impacted by climate change, such as agriculture, forestry, and fisheries. These disparities have created a divide between the global north and the global south, where today the existing economic gap between the world's richest and poorest nations is now 25% larger than it would have been without global warming impacts. Importantly, the economic forces imposed by climate change are expected to have critical knock-on impacts on skin NTD incidence and control. Consequently, by 2030, the World Bank estimates tens of millions of people will be pushed into poverty due to climate change, with poverty serving as one of the strongest determinants of climate vulnerability and a major cause of migration. By 2050, the displacement of 250 to 1 billion people is predicted as a result of both slow onset climate impacts, such as sea level rise, droughts, water insecurity, and ecosystem destruction, as well as by acute climate shocks, such as extreme weather events. In particular, climate disasters exacerbate existing social vulnerability and political instability and contribute to complex humanitarian crises. Population displacement due to climate change is resulting in a growing rural to urban migration pattern, and that increasingly burdens already overcrowded and resource-limited cities. Mass population migration is also a key issue globally due to the anticipated alteration and amplification of infectious diseases and the expected exacerbation of health disparities. A prime example of this scenario is the Syrian civil war, which ultimately stemmed from rural to urban migration triggered by prolonged drought and poor water use policies in Syria. So case in point about disease, with parasites like Leishmania tropica, in which humans are the primary reservoir, recrudescence of Old World leash was seen in Syria in association with this conflict. So in addition to the direct impacts of climate change on the incidence of skin NTDs, populations who are most at risk for NTDs are also the ones who experience the effects of climate change first and have the least resources for adaptation and resiliency. Consequently, the pressures that are constantly applied by climate change amplify these multidimensional disparities and accentuate health impacts, thus perpetuating the cycle of inequity. This vicious cycle underscores that the critical interlinkages between climate change, health, and equity must be addressed in NTD control strategies. The WHO's strategic framework for skin NTDs was prepared as a companion document to the roadmap, and it's there to assist countries in reducing morbidity, disability, and psychosocial impacts of skin NTDs. The strategic framework is underpinned by the UN Sustainable Development Goals and emphasizes shared goals, increased country-level accountability, and integration and resources for such. However, impacts from climate change act as threat multipliers, amplifying disease burden and disparities, increasing medical demand, damaging critical infrastructure, triggering population migration, and destabilizing nations economically and politically, any of which could potentially derail progress towards achieving NTD control. Yet these specific climate-related barriers to successful integration and control of skin NTDs aren't addressed in this framework. The 20 integrated interventions listed here are recommended for skin NTD control. All of these are highly susceptible to climate change, either directly or indirectly. And thus, prioritization of these impacts must be addressed for successful NTD control. And I want to end by just emphasizing again that global climate change affects every human and every nation. However, the complexity of the interactions between climate change and impacts on health and health systems, especially for those suffering from skin NTDs, is particularly precarious. Climate solutions require a multidisciplinary approach, so dermatology cannot operate in a silo. To achieve integrated prevention and control of skin NTDs and to achieve a healthy and livable future for everyone, we have to continue to engage stakeholders and collaborate with other sectors to develop innovative, cross-cutting solutions that consistently consider climate impacts and include climate mitigation and adaptation strategies. Funding a climate and health research agenda must also be prioritized to fill knowledge gaps and identify barriers and opportunities for integrated control in the face of climate change. We must champion education, and our advocacy and policies must support resiliency and justice in vulnerable and marginalized populations. Thank you.